Thank you so much. Assalamu alaikum again to all of you who have joined us. May Allah Ta'ala give us strength to do whatever we should do in Ramzan. Ramzan Mubarak to all of you. Uh, First of all, the first speaker we have is Rabih. Rabih is Medication Safety Officer at Cleveland Clinic, and he wanted his introduction to be simple. So Ravi, you can start your presentation so that we can have a lot of knowledge from you. The group is intended, you are attending the session from the group Give Back to Pakistan, and the group came into being at the end of IVPN conference in 2018 November. And the aim of this group is to build the capacity in all of the professionals in Pakistan and all the Pakistani pharmacists who have learned and get their degree from Pakistan and are working abroad are trying to give back to the country so that the profession can proceed in their country and to all over the world. Ravi, I will give over to you now.
Thank you. Assalamu alaikum.
Walaikum assalam.
And I applaud you, everyone, mashallah, for all the effort and the work that you are doing for advancing the practice. And Brother Muhammad Siddiqui, I really respect you for all the work that you're doing and for this initiative and giving me the opportunity to share some ideas and thoughts with you, and hopefully be able to discuss things and learn from you guys all as well. Today, I'm going to be talking about a concept developed over the years that I call the caregiver information rights. Basically what it is, when you think about the patient safety rights, we think about giving the right medication at the right time, for the right indication and all of that. There have been 6 and some organizations have about 10. You can add on the list more and more. So the concept of the caregiver information rights that I wanted to talk about a little bit more is making sure that you're always providing the caregiver with the right information and the right place and the right sequence and developed by the right person from the right person. So for example, if you're preparing information for physicians, it's different than if you're providing information for a nurse or for a pharmacist. A physician might not be as interested in the dilution instructions as a pharmacy technician would be. So where you provide that information is of value and should be a factor to consider whenever you're preparing that information. Making sure that it's also at the right time. So for example, if I'm about to administer a medication, I might not be as interested on what are the dosing instructions. At that time, I want to make sure I'm giving it at the right duration and at the right rate. And then for me, for those who know me, I'm big on design. And because you might have a lot of knowledge that you're trying to show, but if you're not showing it in the right sequence and in the right format, then sometimes it loses some of that value. And sometimes you might have something of no value, but the way you're presenting it, it gets the attention and that people are trying to show. So if you think about how humans process information, it's usually by touch, by sight, by taste, by hearing, and by smell. And if we know smell is known to be one of those factors that elicits memory the most. But how do we receive information? 80% of the information that we receive comes from vision. So the first thing that you're going to make a judgment on is going to be the thing that you see before you hear it. So this is where we also focus more on the value of design and how you show information. So these are some of the key principles when you think about human factors and how to display information. So you have to think about the importance and the frequency of use. So you want to place the most important and frequently used information within the easy reach of the caregiver. So, and try to display that information centrally in your visual feed. So there's something that we call visual pollution or clutter, is when you have a very busy slide or a very busy piece of information that, because there are so many things on it that you're trying to, your intentions are good. You're trying to show a lot of important information, but sometimes if you show too much, it loses its value. So you have to think about where you're showing that information and is it really relevant to what you're trying to communicate. And then the second thing you want to think about is the functionality. So you have to try to think and group that information and displays that relate to the same type of together. So for example, for physicians, ordering instructions are what they need to see. For pharmacists, it's going to be maybe preparation, double checking the doses, any allergy alerts or lab that they need to know about before they verify medication. And then for the nurses, the main focus is going to be on administration. And like I mentioned before, for technicians, it's about the the preparation instruction and sequencing. So again, place information in the same sequence that it will be needed. And then visualization, design your information and displays that are intuitive to interpret. So if you feel that there's an icon that you're using that can be misinterpreted or has a different interpretation based on the audience, avoid using it. Or if you decide to use it, make sure that you place an explanation underneath it. So here's an example so these are some principles. Again, these are the things that I've acquired over time. I've learned from a lot of different mentors that I've worked with and some different readings. So it's hard to find them in any specific article. These are just things, anecdotes, that are learned over time. So try to minimize the visual noise. So for example, if you see, this is a hypoglycemia protocol that we developed years ago. And then we saw that there's a lot of clutter. There's a lot of redundancies. So try to group and use sometimes like very simple equation. I like to use two things, either bullet points or tables to try to simplify information. So went from this to this. If you can notice, try to show some sequence, like when this is this, then use this, and try to use bullet points. This is, for example, in our computerized prescriber order entry system. Every single system has a different function and it's done in a different way. But what you want to think about is how do you take that information and then you also adapt it to your workplace. Simplify your options. Here's an example. A physician might not be interested on the concentration right away. Here you have 5 options to select from. So you want to be able to minimize them to just choose one, right? This is the less options you have to choose from, and the less chances that you have to make an error. Third of all, think about placing information where it's needed the most. So for example, this is our medication administration record for nurses. So a lot of that information, if it's a PCA, you want to have a PCA job aid or PCA procedure. Any references that you have will be available at the bottom. So these are examples of also including all the information that the nurse needs to know. For example, when we first opened, we had some issues with nurses choosing the wrong type of syringe. So if you notice at the bottom, we told them select the BD 50, 60 ml plastic syringe. So you've included that information for them, so they don't have to go look for it in different policies. Always place information where it's needed the most. So for example, how do you tell that this is a high alert and lookalike medication in the system? This is an example of our Pyxis machine or our automated dispensing cabinet. We are not a fan of using labels left and right. And I think Muhammad Siddiqui definitely agrees with me on this, because if you start putting labels everywhere, then they lose their value. And then if you forget to put it one day, everyone's going to come back and tell you, why did you forget to put a label? So one of the things that we have done is that we, for example, for fentanyl, the minute you log into the automated dispensing cabinet, you will see high alert and lookalike, sound alike. And this is where you have the value of the support of your IT team and your IT infrastructure, because they're essential in taking the ideas and putting them in action. Because any idea that you have, if it's not put into action, is of no value. Here's another example where we've used our automated dispensing cabinet for magnesium sulfate in the OR. So for example, before the caregiver is able to remove it, it tells them what are the information they need to know. So again, in sequence, it's telling you here, use a filter needle, how to do the dilution, how to administer. These are 3 important information that they need to know as before they even remove it from the device. Place your information in one place. So for example, in our computerized order entry system used by the pharmacists, we have a section called links, pharmacy links. So this links you to the most important references that a pharmacist might need to use in order for them to perform their day-to-day function. So as you can see here, there's a link to the infusion pump library, the setup, your online references for drug information. For example, if you have a narcotic incident, there's also access to the form that you can download and then utilize right away. So also this minimizes the caregiver having to look for information all over the place. And the idea also is what you want to make sure happens is that any documents you refer to here should be in a centralized place, and it's only updated by one person, so that you always make sure that they have access to the most up-to-date information. Create visual guides. It's all about, they take some time, but they are of a lot of value. So this is a document we worked on about 2 years ago, where we were having a lot of issues with the nurses not labeling properly the medications, not knowing what are the requirements from a regulatory perspective. So we went in, we did some samples of what the label looks like. We've reformatted some of the labels to adapt to the needs that they have. So for example, we had an area for them to write down the time they hung the medication. In the past, they used to have to put a label. So that's one less step. That's one less label you have to add. And then we created a visual for them, showing them exactly what are the labels that we use. For example, for fentanyl, because we knew it's a high alert medication, we made sure that we incorporate the word high alert into the label. So that way you don't have to add 2 separate labels. And again, also guiding them on where to place the labels. So these were printed and they were placed in the different areas within the hospital. And then you can develop something similar. Whatever you're trying to design has to adapt to the messaging and the needs of your organization. And some of this can be used in very sophisticated software, but you can also use something as simple as PowerPoint to do a lot of those design. And do what Mohammed Siddiqui does best. Try to find these eager interns that are very artistic, they have a lot of interest in designing things, and capitalize on that talent that they have and able to support you in doing that work. So taking that concept of enablers and expanding on it. This is an example of a insulin therapy management guide that we have attached to every insulin order. So for example, it guides the physician, the nurses and the pharmacists knowing the different types of insulin. This is an example of a guide that we developed that lets you know every medication where it can be administered in different areas. And I'm going to go back again what I mentioned for you here. For example, if someone might not interpret this correctly, at the bottom of the document it tells you that this is a face shield, this is a gown. So this might be a document that looks nice and clean, but you have to also remember it takes a lot of time to work on, and you need to have someone who's dedicated to making sure it's being updated on a regular basis. When you're trying to show a complex workflow, try to simplify it into very basic steps. I like to use icons and I like to use numbers. So basically in a quick visual, this is, for example, an example of how do you do a formulary submission. For example, step 1, you submit the formulary request, reviewed by a pharmacotherapy specialist, and then goes to FTC, and then you add it. So, and then you can break down every single step into multiple details. Because if you cannot put something in simple steps, it means that then you probably don't have a full understanding of how it works. These are examples of also how you can do visuals. These are all were done in PowerPoint. So, again, there are a lot of resources that are out there that you can utilize, so you can capitalize on those. And then one of the last things, because I know we're running out of time, is organize information as much as you can. Try to think about acronyms. So for example, what we did for our inpatient pharmacy, nurses, when they call us there, the first thing is like, where's my med? So we use my med, MYMED, as being the number for the pharmacy, the inpatient setting. We've used my RPH for the ambulatory. Try to organize information in a table format, because it usually puts things in different categories and it allows you to reach them usually in a quicker manner. And I think this concludes my part. Any questions?
Thank you so much, Rabih, for a great presentation and such nice information. I have a question that I wanted to ask, and that was, what type of training you had to be in your current situation or your current position of being the medication officer?
So so the question was what were the requirements or what kind of training?
Yes.
For my training, it started with interest. So during my residency days, I was always interested in looking for things that were going wrong. I was more interested in these things than the clinical stuff. What I ended up doing is that there is an organization in the United States called ISMP that I'm sure you're familiar with, the Institute for Safe Medication Practices. You can access them on www.ismp.org. It's a non-for-profit organization that has a lot of free information that are out there. It's really the best reference to go to. So I was fortunate enough to apply for a fellowship and spend 1 year there. But also other options for that, the American Society of Health System Pharmacists and ISMP, they have a certification program in medication safety. So it's a course, I think, which is about 12 modules. And you can also, there are options for doing residencies in medication safety. But I chose to do the ISMP fellowship for 1 year. So that was my background. But what I've learned over with time is it's really working in an organization, reviewing medication events, learning from the different team members that you work with. This is where you learn all of your, the wealth, the knowledge that you get.
Thank you so much. One thing that I wanted to request, we have small time, but if you can share a case study of one of your medication error that you find out and you solve it, how it was that experience of solving one of the error or trying to build something, just one case study if you can share.
One case study. So, well, one thing that we did is that when we first opened the organization, we had the concentrations on the infusion pumps showing up in milligrams per ml or micrograms per ml. So we, from a pharmacy perspective, and this goes to the idea of you have to display information based on the end user. So for us, pharmacy, we think more in milligrams per ml. But nurses, or micrograms, but nurses, they think about strength. So for example, for us, we might say this is 1 milligram per ml. The nurses are interested in 100 milligrams per 100 mLs. So I'm trying to remember what was the specific concentration, but I recall it was a 4 milligram per, I think 250 milligram per 250 ml product. But the nurse mistaken the concentration for something else that was in micromilliliters, because again, they think in strength, we think in concentration. So what we end up doing is when we were doing the root cause analysis and we were speaking to different nurses, they were saying, no, they don't necessarily look at the concentration, they look at the total amount in the total volume. So what we end up doing is we change how the information shows up in the infusion pump. So for example, this is now it shows up 4 milligrams in 250, and then you see the concentration. That is one example that we had. Another one I can refer back to, we had a patient who presented in the ED because they had taken methotrexate daily. Fortunately, the patient only had a severe rash versus having something that could have been extremely, it could have been a sentinel event. So what we had done with that is that we had made several changes in the organization. One is that we limit the number of methotrexate pills that we dispense the first time the patient takes it. Because, so for example, if you dispense 50 and the patient misreads it as once a day, despite all the instructions that you might have given, they're gonna end up taking 50 or 50 days. But if you only dispense for them 1 month supply the first time they receive it, then even if they overdose on it, they're only gonna overdose on 4 pills, and then you're able to catch them when they come back and ask for a refill. So that is one thing that we did. We produced a video called Ask that also talks about, always asking questions. And what we did, we also designed a label and we placed it on top of the vial in which we dispense methotrexate. And it says once a week. And then we also introduced on it a ribbon where you can actually write the name of the day, the name of the day of the month, the week that you're taking it. So it will say once a week in Arabic and English, and then they write Monday or Tuesday or Wednesday, whichever one it is. And you have the patient write it because you tell them the first time you take the pill, write the day of the week that you took it, and then make sure you're consistent.
Thank you so much for such an interesting information. We are very grateful for your time.
Oh, my pleasure. Thank you.
Thank you so much. Thank you. So second person we have expert Zeeshan, Mr. Zeeshan, who have joined AKU as intern pharmacist. He has worked as drug information pharmacist at AKU and now working as inpatient pharmacist at Cleveland Clinic. Zeeshan, bhai, over to you. What you are giving us today from your knowledge treasures.
Assalamu alaikum, everyone. Ramadan Kareem. Let me share my slides with you first.
Just one minute. Everybody is asked to type the question if they have from the presenter.
Okay, assalamu alaikum, everyone. Thank you, Marine, for the wonderful introduction. And I would also like to thank the organizers of this event to invite me to speak on this topic. I would not consider myself as an expert on this topic, but I have worked in AQH as a drug and poison information pharmacist for considerable amount of time. So I feel I would do justice to this topic. So moving on. I have nothing to disclose, and at the completion of this small activity, you will be able to discover the drug information and what services are provided. Define pharmacist's role in providing the drug information, explain steps to respond to drug information requests, and list the different drug resources, and what are the quality control measures and documentation of drug information that you provide. So a little introduction about the Drug and Poison Information Center. Drug and Poison Information Centers are the specialty area within the realm of clinical pharmacy. So usually it is operated by a clinical pharmacist or any pharmacist who is trained or have a formal training in providing drug and poison information. So drug information, it can be for patient specific, it can be for academic or educational purposes, and it can be for population based to aid in the decision making for medication use evaluation and making policies. So the purpose of the drug and poison information actually is to serve the healthcare professional by answering critical questions on the drug use. It can be a physician, it can be nurses, it can be any other healthcare professional working in the hospital. If they have any questions related to the drug and its use, obviously they will call someone in the Drug and Poison Information Center. And drug and poison information centers are usually run by these specialists who are trained or who have experience and have a clinical knowledge and skills, which allows them to provide clear, concise, unbiased, well-referenced, and critically evaluated drug information and recommendation regarding the drug usage to enhance the quality of patient and patient outcomes. So Drug and Poison Information Center can be operated as a part of organization or independently. It is not necessary that Drug and Poison Information should be affiliated or should work under an organized hospital organization as its department. Many Drug and Poison Information Center in the United States, they operate independently. Like it's a separate entity as a Drug and Poison Information Center. They have their whole staff and itself. It is an organization which is providing their services. So it can be affiliated to any hospital or any organization, or it can work as an independent drug and poison information center. And obviously, if you are willing to run a drug and poison information center in your organization or as an independently, you should have all the resources available to run it properly, like system, like you should have subscription to the well-referenced, peer-reviewed, high-impact factor journals and online databases, which we frequently use to provide drug information. Obviously, you cannot rely on the social sites or search engines like Google or any other. You should provide the well-referenced and unbiased and critically evaluated information, which you can get from tertiary sources or secondary resources or primary resources. So you should have all these three available in your Drug and Poison Information Center to run the operation smoothly. So a little bit about the history of the Drug and Poison Information Center. It was first established in 1962 in University of Kentucky Medical Center, and it was intended to be utilized as a source of drug information for physicians and dentists and also the nurses who were working there. And in 1973, there were around 54 drug information centers in the United States. And since then, it has evolved, like the technology has grown exponentially in the past decades. So the role of pharmacists in Drug and Poison Information Center has also increased. Moving on to the next slide, drug information services. So the pharmacists who are working as a drug information pharmacist, they do not only provide drug and poison information services, but other than that, they also support in pharmacy and therapeutics committee, and they serve as members or secretary who arrange the meetings and prepare the monograph and collect the request of all the new addition or deletion. The drug and poison information pharmacists, they can help in developing these reports for the pharmacy and therapeutics committee. Medication use policy, they can also be utilized to develop medication use policy, formulary management, yearly or biannually basis. They should review the formulary and let all the departments know that which medicine they want to give, which medicine they want to delete. On the basis of that, formulary management can be done. Research and publication should not be limited only to the Drug and Poison Information Center pharmacists, but they should include all other pharmacists working in different areas, but they should collect and keep all the records in the Drug and Poison Information Center. They should also conduct medication use evaluation, and if possible, they can publish that. And most important aspect of Drug and Poison Information Center is the education of the pharmacists who are working in the hospital in different areas, education of the interns and students who are coming to the hospital for training, and also the training and education of the fresh pharmacists who have joined the organization. So it's an ongoing process, and drug information pharmacists should take part in educating the pharmacist community. Moving on, so the ASHP has provided a guidelines that is called ASHP guidelines on the pharmacist role in providing drug information. You can Google it. It's a small, simple 6-page guidelines and very comprehensive, which explains everything about the pharmacist role in the Drug and Poison Information Center. So basically, they have categorized these activities, what pharmacist role in the Drug Information Center is, into 5 big categories, which is one is drug information activities. So drug information activities are the anticipation and evaluation of the need of patient and healthcare providers. Like, for example, if a drug information pharmacist feels that he is getting the similar kind of call from a lot of calls from the patients, so they can develop an education material and disseminate into the community, or they can also anticipate or evaluate there is a particular request from the nurses, or they receive a frequent call on some topic from the nursing side, so they can make a presentation and arrange and give the lecture on that particular topic, so as to clear all the confusions of nurses if they have, or they can also make flyers for that and distribute and disseminate the information to all the nursing and other healthcare professional teams in the hospital. And it's also creating educational resources, same like flyer, doing on presentation, and time to time just reminding what services the pharmacy and drug information is providing, and percepting and education of the students, and quality improvement projects, if any, in the hospital. They should take adequate part in the quality improvement project. And percepting and education of the student is very important, because obviously those students and the new pharmacists, fresh graduates, will obviously take over the profession further. And approaches to respond to drug information requests. So ASHP has defined 7 or 9 steps in their guidelines, which a pharmacist should follow when he or she should reply to a drug information request, which I will discuss in the next slide. Documentation and quality assessment. Documentation is obviously an important aspect. If anything is not documented, that means it's not done. And documentation may help you with the medical legal disputes, if any arises. It will provide basis for the assessment. The pharmacist who is working on the Drug and Poison Information Center, if he will document his activities, obviously it will be a point for his assessment as well. And it will documentation, it helps in the accountability as well. And quality assessment, the quality of the drug information you are provided. You can take a feedback from the nurses, or you can take a feedback from the people you are serving, annual feedback, biannual survey, or every quarter as you can send a survey and take response on the services that you are providing. And the resources should be credible and use appropriate resources. You should not obviously use research
Zeeshan, we cannot hear you on this slide. Hold on a second, guys. He's looking into that.
Hello, can everyone hear me?
Now we can hear you.
I don't know. I'm sorry. There was some glitch. I don't know what happened. Suddenly everything froze, so I had to. Okay, so this is the last slide. Can everyone hear me now? Okay.
Yes, we can.
Okay. So from where you guys want me to start, from this slide or this slide?
I think we were on last slide.
Last slide. Okay. Okay. So there are 7 steps to respond to drug information. The drug information request. ASHP has mentioned 9 in their guidelines, but I have compiled them into 7. Secure requested demographics. Obviously, you want to know who is calling you. So you have to secure the requested demographics, and you can guess as well that who is calling you. If the person is calling is a healthcare professional or he's not a healthcare professional. If someone calls you and asks something about does this drug affect kidney, does this drug has any effect on heart, so obviously you can say that this is a layman person. But if someone calls and say does it have any renal issues or cardiac issues, so obviously you can guess it's some healthcare professional, because you need to secure the requested demographics because your response was based on the patient understanding. And obtain the background information. If you have a drug information, you basically should obtain as much background information as you can get from the patient, because one drug can have different dosage and different duration of therapy in different conditions. So securing background information is very important. Sorry, okay, and determine and categorize the question. For example, if you receive a drug information query and this is a nurse who is calling you to check the compatibility of one medicine into any fluid, so you will be directly directed towards that particular category of the question. Like, for example, if you go to the micromedics or if you go to the lexicon and you search a type of drug, and it gives you many categories. It gives you many categories, and you can, if it is the IV compatibilities, and you can directly go to the IV compatibility, read about that, and have its second check from any other resources like micromedics and lexicon, and then you can formulate your response. Develop a strategy and conduct your research. If it is not a simple question which requires some literature evaluation, so basically you can start from the tertiary resources like micromedics or your softwares, and then you can go to PubMed, which is your secondary resource, and you can find the journals or originals research on that particular subject, which you can read and critically evaluate that, and you can base your response on your evaluation. After performing the evaluations of the step analysis and strength, you can formulate and provide the response. So when you provide the response to physician, you can discuss everything which you came across while searching this question. If there is a difference of opinion and original research and some other articles, so you can also discuss that, and so that the physician can decide whatever is best for that patient and conduct follow-up and documentation. Following up is obviously very important for ensuring that the information which you provided was well received, and always document your drug information queries, so it may serve as a future reference for you, because many times we receive the same kind of drug information requests from different healthcare professionals. So you can refer them back and have it as a reference point while you have done all the search on that particular question. So you can just read that and base your response on that research as well. Okay, I got some request that please discuss the resources from the last slide. So about resources, the resources which you obviously um, should follow, it should be appropriate and credible resources, not like you cannot use a search engine like Google or Yahoo for responding to a drug information question. It should be a reasonable or credible resources. If you are checking it in the journal, it should be high impact journal, well referenced, critically peer reviewed journal. So this was the main point in the resources that you should consult while formulating your response to any drug information question. Okay, so
Thank you so much for such nice presentation. One question that was to be asked was, what do you think that many of the hospitals do not have drug information center? What are your comments on that?
okay, so the organizations which doesn't have a drug and poison information center, the pharmacists who are working there, they can take the lead and they can become themselves as a drug and poison information center. So it will require a little effort more than going beyond your daily job description. You should keep yourself up to date, read about the new guidelines or read about the new literature available to you, and develop a mechanism to share or disseminate that information among your pharmacy colleagues, among the physicians and other healthcare nurses who are working in your organization, so that it will develop a credibility on you that this person is following and keeping up to date, so you can develop yourself as a drug and poison information. As our director says that every pharmacist is a drug information pharmacist. If you don't have a dedicated drug information center, you can develop yourself, you can work on yourself to make yourself as a drug information pharmacist, and you can provide that information while working in the inpatient pharmacy, while working in the outpatient pharmacy, while working in the any domain of the pharmacy.
Thank you. The next question was, can you please elaborate the secondary, tertiary resources?
Okay, tertiary resources are the softwares, the search engines which we use frequently for our drug informations, like Micromedics, like Medscape, like Lexicomp, like UpToDate. So what they do, they compile out all the guidelines, all the original articles and research, and they read and summarize all those into one drug monograph or pamphlet. So that is basically a tertiary resources. Secondary resources are the like PubMed and Embase, where you can search for the original articles or the clinical trials, and those clinical trials particularly done are the primary resources. So secondary resources and tertiary resources are always based on the primary resources, but they do not compile each and every aspect of the primary resource. So if you have a difficult query or if you have a question which requires you to, if it is not like a dosing question, what is the dose and what is the duration, if it is something to related to the events or side effects or serious condition treatment, anything which is serious, you should go back to the primary research or primary literature of that particular trial for that particular, from where the guideline was developed. So that is the primary resource which you can refer.
Thank you so much for such nice information. Nimra, we have recorded your question and you will be answered later for the paper of time. Now we have, thank you so much, Zeeshan bhai, once again.
Thank you, Marine.
Now we have Zaad. Zaad is currently working as manager of Medi Pharmacy, and he was also the intern at AKUH, and later he worked on various organizations, and we expect from him many information regarding community pharmacy, and he is expert of this area. Zaad, over to you. Zaad, we cannot hear you.
Assalamu alaikum, everyone. Thank you very much, Marine, and the organizers for giving me this opportunity. I am not so much and richly experienced like most of the guys here, like Zeeshan Bhai, Aslam Saab, Tahir Saab, and Arif Bhai, and many others participants. But thank you again. Uh, yes, whenever I have been asked regarding any presentation, I always opt to choose community pharmacy because it's quite close to my heart, and that's the real reason that I'm choosing this topic again. Uh, Actually, I am sharing you an experience of my personal and an experience of a community pharmacy which aimed to be uh, one of the largest and biggest community pharmacy chains in Pakistan, and they got the plan from the UK, but unfortunately they couldn't be able to survive because of several reasons. When we think about um, community pharmacy in Pakistan, if you know about the stats, only 8 to 10% of the passing out graduates used to join community pharmacy, which is quite far behind than the world level. Uh, we became pharmacists. We all are pharmacists, interested in doing research work, to part of healthcare team because there are a number of jobs. But one thing we always been on the left hand side or put behind their own sort of investment. Uh, we can build. But one thing that is most worthy in case of pharmacy business is entrepreneurship. That you can own your own business and you own your own business. And entrepreneurship is a way that you can lead and find a way that will actually can lead to the glory. But I am showing a test case. Which I earlier said that it's a community pharmacy chain from UK that wanted to have a chain of community pharmacy here in Karachi, Pakistan. They actually started and when we start a community pharmacy, actually what we have, it's our mission. What services will you offer that will be differ or will be making you more remarkable in the market? Are you clinically competent? Are you competent in terms of management, according to marketing, advertising, technology, promotions? Is there any new idea or any known competition which is going on? A model pharmacy. If we call it a model pharmacy, and if we take on, actually, I am showing the example of that pharmacy which started in around 2000. End of 2016, and they started in January 2017 with a plan of more than 2 pharmacies in a year, but they ended up in 2 years without any further progress or development in their business. When you see about a model pharmacy in, especially in Karachi or Pakistan, then first of all, the objective should be clear. The mission and vision, yes, they have got the mission, they have got the vision, the opportunity rationale. The market information, yes, we have to know the market information, but unfortunately they didn't get the market information. Second, the market potential, to see whether the location which is being chosen for developing or setting a pharmacy is actually a big thing. Marketing entry timing. You can see nowadays in this pandemic, COVID-19, most of the businessmen are doing businesses of masks, sanitizers, so on. So the entry timing of in the market is quite important. Business legal status, yes, they have acquired business legal status. Project investment, yes, we have to uh, look into it. Location, when we talk about the location, then one of our senior pharmacists, Rabih already told us, and they used to say it again and again, and if you want to have a great community pharmacy setup, anywhere in the world, the top three things are first location, second location, and the third one is also location. So actually, it's a game of a location that what you are choosing for developing a community pharmacy. Product miss, product range, yes. We have to be very choosy regarding the brands availability because in Pakistan, whenever a customer used to come, they had to have the fully medicines being arranged at that time. One of the six medicines in the prescription missing, then they will not be coming again and will curse you too for having such a pharmacy which cannot entertain them. Strategic recommendations, we do need them. Customer service, like testings, target outcomes, impact, social, economic, monitoring mechanisms, control, issues and challenges. And the last one is very important, exit strategy. The one which is very risky indeed, but you should have been the exit strategy from the market. So if we talk about that pharmacy, which was quite significantly developed, having more than 26 branches in UK, and currently they are flourishing in the United Kingdom. But here in Pakistan, they joined one of the biggest community pharmacy before Dawago, because Dawago is considered as a pioneer of community pharmacy here especially in Karachi. Before that, actually there was another one. I will not be disclosing the name as there will be any conflict of interest. So they have major ambition. They had a specific major achievable time, realistic opinions, but couldn't be able to survive. What was a factor? When we used to know about the community pharmacy setup or the entrepreneurship, then the market information is very important. They choose in the area where already three giants of pharmacy working from around 15 to 20 years and giving medicines on discount. Here, a general phenomena is very common, which is quite disappointing. That patient used to have to go those pharmacies where maximum discount already being present. And to make you understand, then on a retail setup, when we talk about the community pharmacy, then only 15% discount can be offered from pharmaceutical, and from that, patient is very much keen to have more than 10 or 12% of the discount, which is practically impossible other than you will make some illegal purchasing from the market or any other source. And the timing is very important when you see the community pharmacy setup. Business legal status, yes, they had the license for retail, for compounding as well. They got the compounding, but it didn't click at all. And the main dilemma here, when we talk about the medicines, patients, people always wanted to have the imported medicines. They developed the community pharmacy. They were first set up in Defence and near Clifton, and their patient wanted, even if it's Panadol, then they will go for imported. And here in Pakistan, the imported medicines are not registered, so you cannot keep them until and unless you have some contacts with the regulatory. Okay, it's a serious slide which I want to share with you all. That what we have to. It's not about the community pharmacy. It's about any pharmacy which you actually planning to have, or you are a manager of any hospital pharmacy and you have been sitting in the budget meetings. The capital investment is very important. One, the main drawback of this project, which was not being successfully catered on within 2 years, and they wind it up, is the reason they invested too much of their capital investment. The investment that cannot be revived from them. For example, they PKR rupees 1 crore only on infrastructure, fixture, furniture, and design infrastructure. Other than that, the cost of goods sold. This is the main factor that has to be addressed. If this 1 crore can be expedite on this cost of goods sold, then it will be quite generating some in terms of sales perspective. But it's gone worse for them. And this total investment 1.25 crore, which was actually gone into a loss and a big loss for them, and they could not survive even not even without a break even. Right business model should have availability of regular medicine supplies, a well-trained pharmacist. Though the pharmacists are not so much valuable here in the community and local markets and medical stores, but yes, we do want pharmacists and need to have pharmacists on board. Inventory range, the discount, again, that has to be there. So the financial feasibility has to be the capex, the operational expense, the depreciation, and the P&L. So this was their actual revenue which they were generating for about a month, 60,000 per day PKR, which was about 18 lakh per month. Percentage 5% giving to the patient, while 10% their gross profit, and they were continuously in the loss of 4 lakh per month. That's the reason they couldn't be able to get more of the. What are the lessons learned? Actually, when we know or when we talk about the entrepreneurship, yes, indeed, it's a challenging job, and it is something that has to be continuously taken on the board, either financially or operationally or investment point of view. But if you don't have an exit plan, if you don't have what you say about if you don't have an exit plan and you don't have that strategies on how to cater your initial investment with respect to their capex and opex, then it will become quite difficult to run any of the community or retail pharmacy, or even if the hospital pharmacy have these the measurables are not being taken. That's it. Thank you very much.
Thank you so much, Zaad, for the great presentation. The question that we wanted to ask from you was, how can academia help pharmacists graduating to learn about business model in school? Whether it should be in which year of school?
Actually, Marine, our curriculum here in Pakistan need to be revised. You are well aware of that. We don't have any credit hours working for the community pharmacy for the students. Some of the organizations like NCPP or the WAG or somewhere else, they used to hire trainee pharmacists to make them learn during the undergraduate program. But on official level or in the case of government regulations, they don't have any programs which can actually teach them that how to run a pharmacy, how to make a model, how to become an investor or entrepreneur. If you want, some of the friends of you can come and create your own pharmacy. Why not?
One more question. How you afford a pharmacist in your business model? For example, here in Pakistan, we see that non-pharmacist person can dispense and give medication. So how the owner of the business allows or afford a pharmacist at the counter, because pharmacists will definitely require more pay than the person who is not educated.
Actually, Marine, yes, you are extremely right that even we have some of the pharmacists that used to give their license, their registration for some rental purpose, and the medical stores owners used to actually cash in their license and their registrations. But they have to pay them. You know, while having a license or registration, it's better to have that pharmacist on board, even by paying 10 to 15,000 more. You have to pay for the license. You can hire him or her for your safety as well as your legal requirements. It's not so much when we talk about in terms of financial. You need only one pharmacist actually for which we are using their registration or license, as well as their for about 4 to 6 hours as a pharmacy would be enough.
Thank you. Can you please share the adaptations that you have taken for your pharmacies or for your business model during the current pandemic situation?
Okay, first of all, in our community pharmacies, obviously we have first of all asked them to be ready in their PPEs with their protective measures, with goggles, with their masks, with their gowns, and have already asked the patients to queue up in physical distancing phenomena. Also, we have encouraged the patients to order online. We have a website, we have a mobile application, we have a drug information center, so that it can be reached out. It case of such pandemics, and it worked actually. And we have been receiving a lot of orders online rather than the patient, and we are providing them at their homes.
Thank you so much, Zaad. Thank you for all the participants who have attended. And we wanted to announce that will have the same type of session next week, same time on the Zoom, definitely. And we will have the speaker, Mr. Shamim Raza, the director of Khan Hospital Pharmacy, Madam Salwa Hassan from Islamabad, and Ms. Sumaira Khan from Tabba Heart Hospital. So we will encourage you to get connect and get information. Thanks a lot for coming for attending this session, and we will hope that you will come. You will be attending in future as well. Thank you so much. See you all next week.